Reduced arterial blood flow causes decreased nutrition and oxygenation at the cellular level. Decreased tissue perfusion can be transient, with few or minimal consequences to the health of the patient, or it can be more acute or protracted, with potentially devastating effects on the patient. Diminished tissue perfusion, which is chronic, invariably results in tissue or organ damage or death. Management is directed at removing vasoconstricting factors, improving peripheral blood flow, and reducing metabolic demands on the body. Ineffective peripheral tissue perfusion. Definition: decrease in oxygen resulting in failure to nourish the tissues at the capillary level. Ineffective peripheral tissue perfusion related to impaired transport of oxygen, interruption in blood flow, mismatch of ventilation with blood flow, decreased hemoglobin concentration in blood, hypoventilation, hypovolemia, hypervolemia, exchange problems, altered affinity of hemoglobin for oxygen, hypertension, diabetes mellitus, sedentary lifestyle, smoking, enzyme poisoning. Assessment: subjective data, cardiopulmonary, chest pain, dyspnea, sense of impending doom, gastrointestinal, nausea, abdominal pain or tenderness, peripheral, claudication, paresthesia, extremity pain. Assessment: objective data, renal, blood pressure changes in extremities, femoral bruit, oliguria, anuria, hematuria, elevation in blood urea nitrogen to creatine ratio. Cerebral, altered mental status, speech abnormalities, behavioral changes, restlessness, changes in motor response, extremity weakness, paralysis, changes in pupillary reactions, difficulty in swallowing. Cardiopulmonary, arrhythmias, capillary refill greater than 3 seconds, altered respiratory rate outside of acceptable parameters, use of accessory muscles, chest retraction, nasal flaring, bronchospasms, abnormal arterial blood gases, hemoptysis, diminished or absent pulses, ankle brachial index 0.90. Gastrointestinal, hypoactive or absent bowel sounds, abdominal distension, vomiting. Peripheral, altered skin characteristics, skin temperature changes, skin discolorations, skin color pales on elevation, color does not return on lowering the leg, altered sensations, blood pressure changes in extremities, weak or absent pulses, diminished arterial pulsations, bruits, edema, delayed healing, positive Homan's sign, shorter total or pain-free distances achieved in the 6-minute walk test. Expected outcome: patient maintains optimal peripheral tissue perfusion as evidenced by strong palpable peripheral pulses, reduction in or absence of pain, warm and dry extremities, adequate capillary refill, and prevention of ulceration. Following intervention and treatment, the patient exhibits adequate peripheral perfusion as evidenced by peripheral pulses greater than 2+ on a 0 to 4+ scale, normal skin color, decreasing or stable circumference of edematous site, equal sensation bilaterally, and ability to perform range of motion in the involved extremity.